Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to Ayada's Corner. Today I have a lovely guest with me who will be talking about mental health and substance abuse and some of the work she does in the behavioral health space. Please help me in introducing Lul, who will talk about some of the work she does at the Bridging the Gap Behavioral Health organization. But before we jump right in, I'd love for you to just introduce yourself and given your background, what led you into the behavioral health space.
Yes. My name is Haji Muhammad. I am the founder of Bridging the Gap Behavioral Health, and I am a mental health professional. My background is clinical social work. I have my LICSW and have been doing this for the past, I would say I've been doing this for the past 13 years overall, whether it's was through working with the community nonprofit sector or offering resources. And in the last 7 years, I have been doing therapy, whether it's family therapy, individual therapy, working with also I worked with youth and I was a life coach, and so I have done different things in terms of like serving the community. What really led me to this profession, to think about it, is that I feel like I've been doing this my whole life. As you know, coming from immigrant background, coming to this country as young people, we were basically, we had to pave the way, and we had to be the translators. We played many roles at an early age, so it's like, serving and helping people has been something that that I've been doing for a very long time. Whether it's like working with family, whether it's like working with even neighbors and like translating, helping them with like resources. Basically, whether it's translation, whether it's like whatever. So early on, I knew that I wanted to help people, but I did not know what type of work I would be doing and what that would look like. But I knew at an early age, when I was 16 years old, I started participating in after-school programs and like volunteering and doing different things that really exposed me to different opportunities, where then I fell in love, and I was just like, I knew I wanted to go into this career of helping people. I went to and got my first bachelor, just a degree that was basically, that I created for myself, basically because I did not know what I wanted to do. And so it was a mixture of like, human behavior, it was psychology, and that kind of opened my eyes into like. And then after I graduated with that, I knew I needed to go back to school because I wasn't really satisfied with what I was doing at the time. And I also noticed that mental health was an area that needed to be explored, especially in our community, the Somali community. And at the time in 2007 or 8, I remember there was a lot of death, in our community, where young people were dying and getting killed. And I've seen families really go through trauma, and they didn't have a lot of support and a lot of education around that trauma and what that would do to families. And so when I went back to school, I actually moved to North Dakota, and then I went back to school, got my social work, and then I went to the master's program and got my master's in social work. And then at the same time, I was doing this work, whether it was like, as a case manager, doing the in-home family work. I got a job with an organization called Northwestern Mental Health Center in Crookston, Minnesota, where I was the organization was contracted with like 5 different counties in northern Minnesota, and I was serving, and I've worked as a life coach for foster youth, where I was like helping them, linking them to resources, educating, even providing education to the families. Sometimes like I was really hands-on, being in the community, really like teaching them life skills that that they didn't have, and that was really good fit. And then after that, I started doing in-home family therapies, where I was going to like family homes and providing in-home family therapy, and I really enjoyed that. And I kind of, even when I was doing that work, the majority of people that I was serving were folks of color that were in rural Minnesota, and I really enjoyed that because I felt like I was bridging that gap, and just me being that provider of color where, my clients felt connected, felt understood. It was really empowering. And because of that, I knew I needed to come back here and do that for my community. And kind of go back to is I did all of this experience work and training because I wanted to come back here and I wanted to do a great work. I wanted to be competent in what I was doing, so that way I can come here and really be there for my community and create services or resources that is not there, and kind of and that's what I did. I moved back 3 years ago, and when I moved back, I was working in a residential treatment as a counselor, and then I started working as a clinical supervisor, and it really opened my eyes because a lot of the clients that we were getting, especially folks from our community, a lot of times it's like when they are at the level of like maybe probably being hospitalized so many times due to their mental health, that they were coming to our residential treatment, and a lot of times it was court ordered. It's not like they were coming on their own, and so it was heartbreaking because I feel like when people don't want to be there, there's not much that happens. There's not a lot of change that happens, and I wanted to create something that was different from that. I really wanted to create an organization where I can serve the people that actually need the help, that want the help, and that that can decide what type of services that they want and who they want to work with. And so right now I'm in psychology today, and it's been really great. A lot of clients, especially from Somali background, have been looking for services, and I feel like mental health is changing now, and I feel like a lot of people are more open and more willing, but of course there's still that stigma. And that's kind of my background. I mean, I don't want to talk about myself too much, but that's kind of what led me to this career path, is my own personal experience, whether it's like seeing, the things that were happening in our community, and also my own personal experience as well. And so, yeah, I hope that answers the...
That did, and I do want to say that, yes, this is about you. This conversation is about the work that you do for our community, so please, don't feel like you're oversharing. I think everyone wants to hear from people that look like you, that are in this space, and I think there are a few things that you said that I want to highlight. That you took, about 7 years of your career to actually become a trained specialist, and then you went into areas where there are very minimal. I actually think whether it's rural or city, oftentimes when you try to look for a provider of color, it's very hard. And I think the name of your organization and the mission of the work that you're doing, Bridging the Gap, you're bringing people who actually need diverse people with backgrounds, and people that they can trust. Let's just be honest. Oftentimes, mental health is already a very overwhelming topic to actually go seek help. So imagine if you can't find someone that looks like you. So hats off to you for creating something that our community needs. I think just to kind of bridge, I'm going to use the word bridge the topic from last month to this month, we talked about substance abuse, and then you specialize in something that I think oftentimes really brings together this mental health and this substance addiction. Can you, oftentimes people don't associate the two, like substance abuse and poor mental health. Can you speak to us the correlation between environmental and psychological, and how your work and services actually brings together the two?
Yes. And so it's really important to take into consideration, like, mental health and substance use sometimes go hand in hand. A lot of times people who have mental health conditions or symptoms use substances to cope. And a lot of times also there are folks who just, maybe, how people get into them, substance use is different, and how everybody starts is different. There are some people who probably, I will say a lot of times, addiction is connected to lack of connection. When everyone, as human beings, we all need that sense of connection and belonging and acceptance. And when we don't have that, especially for young people, when you don't have that, when that connection is not there, a lot of times we substitute that for something else. So whatever that is, sometimes it might lead people to connecting with the wrong people. But then the thing is, what they're seeking is connection. And a lot of times when they're struggling, they might not find that connection with the people who could be resourceful or helpful to them. And so they seek someone who they feel like can understand them. And a lot of times those people might not, even know, and they just might help them in the way they know. And sometimes it might not be the right help as well. But the thing is, addiction and connection it goes hand in hand. I feel like if when people are well connected, when people are they feel like they belong in their community and that they have something to look forward to, something to get up every day for, that keeps them busy, or boredom is also another indicator of substance use. When you don't have much to do, when you're bored, a lot of times you might get into something, and that's how kind of it starts. It starts as something small, or like hanging out with friends and just like, maybe using, and then it gets to a point where maybe later people start to use it whenever they're feeling bad, whenever they are not able to, or whatever they're experiencing some emotional pain. Then once they start to use it that way, then they kind of become a little bit dependent. And sometimes, it might get to a level where that person might even require more and more and more. And a lot of times, like, as you have heard of, the marijuana is a gateway drug, right? So a lot of times they might start with marijuana, and then after that, like when somebody, like, you never know, life happens to people, and when that happens, sometimes you might look for something to give you like a quick relief, and sometimes finding that and it helps people. But so it's really important when we are addressing mental health, and if someone also has a chemical health concern, we address that together, while also addressing the environmental component, where a lot of times, like, what are the stressors? What are some things, that are contributing to the chemical use as well as the mental health? So addressing the whole person, is it family issues? Is it, employment issues? What is it that's causing the stress? So I don't really look at mental illness or substance use itself as just the main problem, but more so there are other components that are contributing to that. So it's like when we dive in, we have to address the whole person. We're gonna assess, we see what they might need, and then if, like, sometimes, like, if I'm not able to, like, if I'm working with them and they need substance use, counseling, then we get to make that referral. We also, like, address, because I have a lot of experience working with people with dual diagnoses. So yes, I really think it goes hand in hand. It's hard to really differentiate the two, but again, we have to address each one of them and all together, as kind of the whole person.
Yep.
Yeah.
That was a really good overview. I guess my next question to you, going back to you oftentimes being the only provider of color, maybe especially if you think back to your rural, the work that you were doing in the rural parts of Minnesota. What's your definition of culturally competent providers? I think this year is the first time I actually heard about that. Could you give us the definition, and what does that look like in practice when you're with a person who's seeking services?
So culturally competent provider is a provider that will look at things from your own cultural lens, like regardless of your background. Like for me, as a social worker, as a mental health professional, it's my job to be culturally competent, and if I'm not, it's my job to seek that. It's my job to learn the culture and do my research and try to understand. Also, I use my clients as the go-to people to help me understand their culture and their worldviews and what's important to them, and my job is to tailor that to them. We'll make something that makes sense to them, something that they want, and look at things from their point of view, from their own cultural lens, and not mine. So it's like really differentiating that and doing the work needed to be competent is part of our profession. We have to do that constantly. We have to gain knowledge. We have to be up to date in what's happening with society and our communities.
Love that. I love that. Okay, so I know, Somali community, everything is stigmatized. Can you talk about where this stigma comes from our culture, to seek help for mental health, or to even admit that you have mental health issues, or even that you're dealing or struggling with addiction?
Yes.
What's the stigma around that?
So, first of all, mental health in general and chemical health, there's a stigma all across cultures.
Yep. Not
right?
just Somali.
Not just the Somali, but there's a lot of stigma because a lot of times it's associated mental health or being emotionally needing support. It's associated with a sign of almost weakness, which is not the case because it can happen to anybody, and there are life situations that contribute to mental illness. There are things that can happen into our lives that can cause disruption, major disruption, that it's too much to handle for any human being. So because of that, it's still stigmatized because it's like, especially in the Somali culture, it's either you are sane or insane. There is nothing in between. When somebody starts to show signs of like depression, like fatigue, or lack of motivation, or just isolation, when somebody starts to isolate, those little symptoms, sometimes it really it's impactful, but yet people don't see that. They might associate that with laziness, or just this person is doing this on purpose, or is overlooked. And so it's really important that even for people who to pay attention to those things, like once you notice changes into your friend, like somebody that you love, and you notice that, it's good to always be aware of, we never know what's happening in their lives, and so it's really common to see that, and I feel like we need to change that narrative because that's not true. Life happens to all of us, especially with us. We lost our country to civil war. Our people seen so much, especially our parents, they have witnessed a lot of horrible things. A lot of them did. And yet they came to this country, they had to survive, they were going on that survival mode. A lot of times that connection piece that you're supposed to connect with your children and your family, it's not going to be there. You might not have that connection because your job is to survive, your job is to adapt to this new environment, and also you have to provide for your family. And so when you have all that pressure, it's hard to attend to your kids' needs, those emotional needs that are so vital. Because then what happens, a lot of times, it's not the parents' fault. When you see kids are struggling, getting into gangs, getting, into drugs, doing all these type of things, it's also not the kid's fault. Because if you don't have resources, if you don't have those kind of connections and supports, and that's not in place, what are they to do? They're bored. A lot of times they seek out other kids who are probably like them, but they feel accepted and understood, and that's why they get into certain things like gangs, because it gives them that meaning. It gives them some sense of like belonging, community. Yep. So if we really look at it that way, I feel like we would have more empathy for families, because a lot of times if you see a kid struggling, or you see that, it's easier to blame the parents and say, well, they haven't raised them well, or they haven't done this, but they have done the best they could. A lot of times they have done the best they could, and so it's really important that, even with my work, it's like when I'm working with one individual, I'm also working with their whole family. Yep. Because a lot of times they will bring that to session. And so it's like when, like I always see family as a system, and when one part of the system is impacted, it also impacts the entire system. Yeah. So it's always important to look at it that way. Yeah.
And I like how you said that around looking at mental health with more of an empathetic lens, and like looking at that person, where they're coming from, what factors might be leading them, versus just casting stigma.
Mhm.
I think it's easier though to just fall into the mindset of,
Yeah.
okay, this is weakness versus actually uncovering what's going on. But I
Right.
think that was very well said.
Yeah.
So this brings us to the end of our segment, but I did want you to understand that whoever is watching this might be dealing with mental health or might come across this video and realize like, oh, maybe I need to seek, some support based on some of the conversations that we've had today.
Yeah.
What advice would you give this person who's watching the video, or even if they have a loved one in mind that is seeking support? Where do they start? What do they do? How do they begin the process of healing for themselves?
Yes. I will say, first of all, I want to say you're not alone. There are so many other people who are in your same situation, and knowing that, it's really important that you seek help right away. And just know that whatever you do, the first step is to acknowledge that you need help, and don't be ashamed to need help, because actually recognizing that, I think, is a strength. When you know what you need and when you know your limits, that's a damn strength.
That is.
So recognize that and don't look at it as weakness, because it takes courage to do that. It takes courage to take the first step and say, I actually need help, because we all need help. This can happen to all of us. And once you know that, like for me, I understand there is no shame in seeking help. So come as you are. Please do your research. Try to find, a therapist or someone a professional that you can connect with. Also, in that seeking process, you can also get consultation before you sign up to therapy. You can talk to that person. You can get to know them and see what they can offer you. So I think that would be the first step, to kind of look up and see what's out there and find someone that you can connect with, someone that will understand you, someone that's a professional that understands this, the mental health concerns. And so, yeah, come as you are. We are currently taking clients, so Bridging the Gap Behavioral Health, please reach out to us, and I would love to offer free consult. 30-minute consult I offer, and you can choose. Yeah.
So you can also find her on Psychology Today. So if you look it up, it's Bridging the Gap Behavioral Health. And as Lou just shared, she does 30 minutes free consult. So if you're not sure if this is something for you, you can do this, get a gauge for it. But nonetheless, this has been such a pleasure having you. She's a friend, a family member, and someone I look up to. So thank you for sharing this time with me today. And to all of you, have a wonderful, it is December, so have a wonderful rest of the year. Inshallah, we will probably have one more video of Ayada's Corner before the year ends. So continue to come back and watch us, and we look forward to talking to you again. Assalamu alaikum wa rahmatullahi wa barakatuh. Bye, friends.